Hello and welcome to this learning module. In today's session, we will provide an introduction to care of older patients and describe the body system changes that come with aging. This video is intended to supplement any readings or coursework assigned by your instructor. The term geriatric usually refers to an individual aged 65 or older, but age-related physiological changes begin a good 25 years or so before that. We're seeing an increase in the geriatric population right now because healthcare is a lot better than it used to be, and individuals are living longer as a result. We generally tend to think of the elderly as having a lot of health problems, but that's not always the case. There are a lot of active adults in the geriatric population. As we age, however, our body has fewer resources for acute medical and traumatic emergencies. So the older we get, the more difficult it may be to bounce back from a health problem. Ageism refers to the stereotypes, how we think, prejudice, how we feel, and discrimination, how we act towards others or oneself based on age. Ageism can have negative effects on both physical and mental health and can impact a person's confidence, job prospects, financial situation, and overall quality of life. Ageism can be overt, like not getting a job because you're too old or too young, or subtle, such as being patronized or having your competence questioned. When communicating with an elderly patient, an EMT should speak clearly, calmly, and respectfully, taking care to use a gentle tone and simple language. It's important to face the patient directly, maintain eye contact, and ensure that they can see your lips if they have hearing difficulties. Background noise should be minimized and questions should be asked one at a time from one person at a time to avoid confusion. The EMT should allow extra time for the patient to respond and listen attentively without interrupting. Showing patience and empathy helps build trust while addressing the patient by name and explaining each action before performing it promotes comfort and reduces anxiety. Changing physiology of geriatric patients can predispose this population to a host of problems not seen in their youth. For example, a simple rib fracture in an 80-year-old can result in pneumonia or even death. A hip fracture from a low mechanism fall is also common in older people and may lead to serious recovery complications. Sedentary behavior while healing can predispose the patient to pneumonia and blood clots. Many older patients who experience hip fractures do not return to their pre-injury level of activity. The table on the left lists the top 8 most common chronic conditions in older adults as ranked by the National Council on Aging. The table on the right lists the leading causes of death for the year 2023 in adults aged 65 and older. This set of stats comes from the National Vital Statistics Report. Please pause the video here to review the information. Growth and development peaks in the late 20s and early 30s, at which point the aging process begins. The aging process is inevitably accompanied by changes in physiologic function, such as a decline in the function of the liver and kidneys. All tissue in the body undergo aging, and the decrease in functional capacity of various organ systems is normal, but can affect the way in which a patient responds to illness. So let's review the common changes in older patients by organ system. Age-related changes in the respiratory system can predispose an older adult to respiratory illness. We see a decrease in the strength of muscles used for breathing, a decrease in the pliability of the rib cage, and alveoli can become enlarged as their elasticity decreases. Together, these cause a decrease in the diffusion of oxygen and CO2 across the alveolar membranes. Chemoreceptors become less sensitive to oxygen changes in the body, which causes the body to respond more slowly to hypoxia. There's also a decrease in the cough reflex and in the function of cilia, which both protect our lower airways. Due to a combination of these changes, a weakened immune system, and a higher risk of complications from infection, pneumonia is the leading cause of death from infection in most Americans over age 65. Many geriatric patients have underlying health issues, including heart disease, diabetes, and COPD, that make it more difficult for the body to cope with and recover from a serious infection like pneumonia. Increased mucus production, pulmonary secretions, and the inflammatory effects of infection all interfere with the ability of the alveoli to oxygenate blood. As we age, an increased sedentary lifestyle can increase the risk of a pulmonary embolism. Recent hospitalization for medical illness or surgery, smoking, long-distance travel, and infection with COVID-19 may also increase pulmonary embolism risk. Common cardiovascular changes in older adults include increased arterial stiffness and blood pressure, a thickening of the heart muscle, and a higher prevalence of conditions like coronary artery disease, heart failure, dysrhythmias, and heart valve problems. The heart muscle thickens in response to the increased workload needed to pump against the stiffened blood vessels. Arteriosclerosis contributes to systolic hypertension, which places an extra burden on the heart. The ability to speed up contractions, increase contraction strength, and constrict narrow blood vessels is decreased because of the stiffer vessels. Additional cardiovascular complications that increase with aging include venous stasis, which is a slowing of blood flow that can lead to an increased risk of clot formation, deep vein thrombosis, and pulmonary embolism. Older adults are also at an increased risk for aortic aneurysm. In the nervous system, we see a decrease in brain mass and an increase in cerebrospinal fluid to compensate. As a result, we see a decrease in nervous system functioning, a slowing of reflexes, and a decrease in our senses. Additionally, the autonomic nervous system does not function as strongly as it does in our younger years. Elderly patients will also see an increase in neuropathy, which can cause problems such as numbness, tingling, and discomfort in the extremities, as well as the decrease in pain sensation throughout the body. All of the body's 5 senses are impacted as we age. Visual acuity, depth perception, and the ability of the eyes to accommodate light change with age. A number of other disease processes plaguing the vision of older adults, including cataracts, glaucoma, macular degeneration, and an increased risk of retinal detachment. A decrease in tear production will also lead to drier eyes. Hearing is the sensory change that affects most older adults. In particular, high-frequency sounds become increasingly difficult to detect. Aging can also create changes in the ear that can affect balance and makes older adults more prone to falls. The sensation of taste diminishes as we age, which can lead to a loss of appetite or overuse of salt as a seasoning, which can affect blood pressure. A decrease in our sense of smell can also contribute to the blandness of food. Older adults may have a decreased sense of touch and pain perception from the loss of the end nerve fibers or resulting from chronic health issues such as diabetes, which can lead to peripheral neuropathy. This is why elderly individuals may not present with the typical chest pain finding when having a cardiac emergency. As we age, our GI system experiences significant changes as well. A decrease in saliva production, loss of teeth, and a weaker gag reflex affect eating habits and can cause an increased risk of choking and aspiration of food or liquid into the lungs. The stomach empties at a slower rate, which can contribute to feelings of fullness, decreased appetite, and bloating. A decrease in peristalsis can lead to constipation and bowel obstruction. Also, blood flow to the liver decreases, and the liver also decreases in size, weight, and function. This will have a direct effect on how medications will affect the patient. And speaking of medications, drugs like anticholinergics and opioids can impact GI motility. GI sphincters will weaken with age, causing upper GI acid reflux and heartburn, and lower GI loss of bowel continence. GI bleeding also becomes more common in older adults. As we age, the kidneys also decline in mass, which leads to a decrease in renal blood flow and filtration rate, which can lead to disturbances in fluid and electrolyte balance. Renal blood flow may drop by as much as 50%. Diminished kidney function coupled with alterations in GI absorption and altered liver functions cause geriatric patients to be susceptible to elevated levels of drugs and medication in their system. When we couple this with poor eyesight, noncompliance with meds, multiple medications prescribed to the same patient, and memory issues, we see an increased risk in medication toxicity and accidental overdose. Aging also brings decreased bladder capacity, a decline in sphincter muscle control, and a decline in voiding senses. Benign prostatic hypertrophy or an enlarged prostate can lead to difficulty urinating and an increase in nocturnal urination in men. Severe cases of urinary retention can lead to kidney failure. The endocrine system is a network of glands and organs that produce and secrete hormones to regulate the body's functions. It controls and coordinates the body's metabolism, growth, development, reproduction, sleep and wake cycles, mood, and response to stress and injury. The hormones act as chemical messengers that travel through the blood to target organs and tissue to trigger specific physiological responses. Common endocrine changes in older adults include decreased growth hormone and sex hormone levels, including estrogen in women and testosterone in men. Aging also leads to altered cortisol release and slower thyroid and parathyroid function. These changes can lead to decreased muscle mass, increased fat mass, potential osteoporosis, impaired glucose metabolism, and an increased risk for cardiovascular disease and diabetes. Thyroxine metabolism becomes decreased in older adults, and this affects their body's metabolism, temperature, growth, and heart rate. A reduction in other thyroid hormones can lead to hypothyroidism. Glucose homeostasis becomes less stable with age. Blood glucose levels spike more quickly after a meal and take longer to return to normal, increasing the risk for type 2 diabetes. Hyperosmolar hyperglycemic non-ketotic syndrome risk also increases for those with type 2 diabetes. Changes in renal system hormones can affect fluid balance, contribute to age-related hypertension, and impair the body's ability to respond to stress. As people age, the immune system undergoes a gradual decline in both its effectiveness and coordination, a process known as immunosenescence. The production and function of immune cells such as T and B lymphocytes decrease over time due to reduced activity in the bone marrow and thymus. This decline weakens the body's ability to recognize and respond to new infections, making older adults more prone to illnesses such as pneumonia, influenza, and shingles. Additionally, vaccines may be less effective because the aging immune system produces fewer and less effective antibodies. As individuals age, the fever response also becomes suppressed, and the baseline body temperature is generally lower than that of younger adults. This means that what would be a normal temperature for a younger person may actually indicate a fever in an older adult. Roughly 20 to 30% of older adults with serious infections may present without a robust fever. Because fever may be absent, infections in older adults often present atypically. Subtle signs such as a change in mental status, weakness, decreased appetite, or falls may be the only initial indicators of a serious infection. Common musculoskeletal changes in older adults include a loss of muscle mass and strength, decreased bone density, and the breakdown of joint cartilage. These changes can lead to decreased height, stiffness, joint pain, and an increased risk of falls and fractures. Other issues include changes in posture and gait, reduced flexibility, and slower reflexes. A disease called osteoporosis is characterized by a decrease in bone mass. This leads to a reduction in bone strength and greater susceptibility to fractures, including non-traumatic pathologic fractures. The discs located between the vertebrae of the spine begin to narrow, which may lead to curvatures in the spine, also known as kyphosis. There is also a noticeable decrease in range of motion, as well as a decrease in skeletal muscle mass. Common integumentary system changes in older adults include thinner, less elastic, and drier skin due to decreased oil and sweat production. Additionally, the blood vessels of the dermis become more fragile. This can lead to easier bruising, wrinkling, and slower wound healing. In older adults, the sebaceous glands produce less oil, making it harder to keep the skin moist, resulting in dryness and itchiness. Aging skin repairs itself much more slowly than younger skin, taking up to 4 times the length of time to heal. Decubitus ulcers, also known as pressure sores or bed sores, are areas of skin damage that develop when prolonged pressure is applied to a specific area of the body, causing a decrease in tissue perfusion that leads to tissue necrosis or death. The image on the right shows the areas that are most often affected in bedridden or non-ambulatory patients. As we can see in the image on the left, decubitus ulcers can be significant and may lead to sepsis and patient death without proper care. So as we have seen in this video, all of our body systems are impacted by aging. It's important to remember that aging will vary from person to person. However, knowing what changes can occur enables us to better respond to a patient's illness. When caring for an older adult, remember to avoid ageism by writing off their complaints as just getting old, and be sure to complete a thorough assessment. We will discuss geriatric assessment in an upcoming video. Thank you for participating in this learning session. Your textbook provides more detailed information should you want to learn more about today's topics. Thank you for watching.